National Health Service, the biggest employer in Europe, is committed to reducing its carbon footprint. The NHS contributes approximately 3% of England's total carbon dioxide emissions. The NHS is committed to reducing these emissions by 60% by 2050, in all areas including procurement, travel and energy use. In this programme, we hear the views of Sir Ian McAllister, Chairman of the Carbon Trust, who work with the NHS to help cut energy costs and carbon emissions. We also hear from leading sustainability innovators Allied Telesis, Haigh Engineering and Spirax Sarco, who talk about their solutions designed to help the NHS to reduce its carbon footprint.
The Carbon Trust, as an organisation, was set up in 2001, and the whole purpose of the Carbon Trust was to help businesses make sense of climate change. The Carbon Trust is working with the NHS across various hospital trusts in particular, and we have a carbon management programme that helps the trust reduce its energy use and thereby deal with its carbon footprint and deal with the objectives that have been set for it by the Department of Health. We have a 5-stage programme. The first thing is to ensure that there is somebody responsible for managing the energy use and reducing the carbon footprint, because from our experience we found that good intentions actually don't get you there. You need somebody to manage the programme. We then go in, we do a carbon review, we look at what is being used, where it's being used, how it's being used, and then we develop a baseline of the carbon footprint of that particular NHS trust or hospital or whatever it is. The third stage is then to optioneer and look at, well, what could we do in order to reduce carbon emissions? Then we decide on the plan, then we implement it, and then we follow it up. So it's a very, very simple process. And there's lots of support from the Carbon Trust, from workshop groups. We have a toolkit on our Carbon Trust site that people can use. We set up workshops so people can swap ideas. And it's working very well. We've done work with some 48 trusts now. We've saved 125,000 tonnes of carbon, and the trusts themselves have made energy savings amounting to £40 million. So it makes sense to reduce your energy bill and use that money to provide better hospital services.
Allied Telesis is a global manufacturing company of networking products. We've been around now for over 20 years, and our key products are used in a host of industries, from network service providers, healthcare and industry. Our products are key in the ability to move both voice, video and data very accurately, which is demanded now in today's environments, where people need to have the ability to see high definition video, high quality audio and very fast access to data on their computer screens. Our products are also designed to have the minimum impact on the environment. We use state-of-the-art manufacturing such that we do not damage the planet when building the products. And our products are designed to use the minimum amount of energy in their operational use, which not only saves the user the cost on their utility bills, but also has a great advantage on the planet in the fact that we're not generating heat and we don't need air conditioning units to actually then cool our products. We're all familiar today with the ever-growing demands of higher, faster technology. This is also true in the NHS. Patient records continue to get larger and are no longer just a paper or notes written in a doctor's surgery. When you go into a hospital now, you're expected that at the reception area, people can pull up your notes, find out who you are, and direct you to the relevant level of services quickly and efficiently. All of this requires much more computing power than was available initially. And the ability to move this image, this data, from one point to another efficiently and accurately is key. All these cables meet up in a computer room where we have various different products that can fulfill the requirement of interconnecting these with the computer servers. One of our products, the iMap, allows us to mix both copper and fibre and telephone grade cable. allowing us to wire a hospital, especially if it's an old ward, using the existing telephone infrastructure whilst providing the voice, video and data connectivity required by both the staff and the patients. This allows us to implement the technology very quickly without having to close the ward, as we're reusing all the existing cabling. For the last 2 or 3 years, Allied Telesis has been designing our range of green products, which have the minimum impact on the environment. This starts in the design phase, where we have to design our products to ensure that they're both manufacturable with little impact to the environment, but also in their operational life, they have the minimum impact as well. From an operational point of view, we designed our products to have the minimum amount of power. You would never leave a room and leave a 100-watt light bulb on 24/7 for 5 years. The thought of doing that would be crazy. However, computer equipment is left on religiously, 24/7, irrespective of the amount of power that it consumes. Allied Telesis has been a major supplier of networking equipment to industries like the NHS over the last 20 years. Our product features, especially our green story, allow network trusts to save money, especially in today's environment. Given the option of closing wards or laying off staff to meet budgets, why not replace the existing infrastructure equipment with something which is better, cheaper, more reliable, but overall less impact on the environment and with lower running costs than today? The money saved installing Allied Telesis equipment would allow you to pay for additional services. Allied has been recognised for our green credentials, and in fact we're one of the major finalists in the British Engineering Excellence Awards for our green technology. In an environment today where there's constant budget pressure, the thought of closing wards or laying off staff to try and meet a budget is not a very palatable alternative. However, using Allied's green equipment, we can save the running costs on your utility bills and your air conditioning bills. So replacing existing equipment with new Allied Telesis equipment, which is better for the environment, high quality, high reliability, providing voice, video and data services, may be the way forward.
Employees themselves can reduce their carbon footprint, and it's not just the NHS that can do this. We are finding that employees are becoming very, very aware of the issue relating to carbon change and are asking their own companies what they can do as well. So we have also, within the Carbon Trust, a separate organisation called the Low Carbon Culture Company. And the Low Carbon Culture Company will go in to an organisation, including an NHS hospital, and work with the HR people to examine ways in which employees themselves can help to reduce the carbon footprint of their organisation. And in many instances, for example, it's about organising your work patterns so people share a car to work, and with the increasing cost of petrol, that's probably a good idea anyway for the individual bottom line. But there are also other things too. We're all advised to take more exercise, so people nearby sort of walk to work or cycle to work. But many people won't do that unless there are provisions for facilities when they get there. So for example, in our own operation, as we look for our new premises, one of the things that we're looking for is to ensure we have adequate shower rooms so that when people get to the office, have cycled there, they can change and then go to their desks having sort of showered, as you would expect. So it's things like that that employees can do to make a difference in terms of their individual carbon footprint and make a difference to the carbon footprint of the organisation.
Haigh Engineering are a manufacturing company that's been based here in Ross-on-Wye for 55 years now. We're experts and specialise in maceration equipment, predominantly for hospitals and the water industry. We're a significant local employer in Ross-on-Wye, but we do have an extensive network of service and support staff through the UK. Our ethos here is that we control the whole process of designing a product from the start, from the design point of view, all the way through manufacture, and then follow that up with service and support. All of our staff here most of our staff here have been through an apprentice scheme, which we work closely with the Hereford Group Training Authority on. From a design point of view, because we have our design here, we can be very responsive to the market, and then with our in-house facilities, machine shop, and general production assembly lines, we can respond to what the customer needs very quickly, and that's been to a great advantage recently, especially given what's going on in the economy and all the new environmental concerns that have been coming up recently. Here at Haigh, we've obviously seen the increasing needs of all of our customers, in particular the NHS, to improve their environmental credentials and the pressures that they're under at a much bigger scale.
At Haigh, we've been manufacturing a range of bedpan disposal units since 1964, when the disposable bedpan system first came onto the market. We've continually developed the machines since that time, and the latest thing we've done is develop the Sluicemaster Solo, which is a single bedpan disposal machine designed for isolation wards within a hospital. The idea being that the bedpan is disposed of in the isolation room itself and not carried down the corridor, thus being good for cross-infection for the hospital. After that, we've found the other benefits of the Solo to be the other low usage areas within the hospital, the clinics, x-ray departments, and low usage areas. It complements our existing range, which was the Sluicemaster Classic Plus and the Sluicemaster Panaway. Both those are 4-pan capacity machines, and the Panaway is an award-winning market leader, saving water consumption. 86,000 litres of water a year could be saved by using the Sluicemaster Panaway compared to other models on the market. We've added a hands-free operation to that machine now, so that we can swipe your hand and the lid opens automatically rather than have to touch it with the buttons with your hand and when you're carrying the bedpan. That's been something we've developed with infection control nurses have wanted to see, and we've added that to the range.
We have a highly qualified team of service engineers throughout the UK. They are all fully equipped with spares. And our aim is to provide a very quick response time to all customers to limit the downtime of machines when they've actually broken down. We offer warranty calls, service contracts, in-house training for hospital engineers, a service technical support line at normal standard rate, and an email support.
Well, we have a proud tradition in ensuring that we have a highly trained workforce. Throughout all the training, we have to consider health and safety and the environment, particularly so these days, and this consideration is taken through all aspects of the company. Regular discussions take place to develop knowledge and skills. We always ensure that the loop is closed, so that this brings expertise back through to our products and processes. This ensures our sales and support staff has the skills and experience to deliver expert advice and the service to our customers.
Here at Haigh, we're committed to a continued process of improving our products through listening to our customers and their needs. In particular, recently, the NHS carbon reduction strategy has become more and more important, and we're taking that sort of requirement into our design process for current and future product developments. So again, in our niche, we're taking the fundamental needs for now and the future to make sure that we can keep our competitive advantage by developing the right products for the market. We're seeing infection control become more and more important outside of the NHS, with the private sector taking its lead from the developments and improvements that have been going on in the NHS. And gradually we're also seeing that actually come about overseas, in particular in the United States and Australia, where these sort of requirements for cutting down on infection and improving environmental credentials are becoming more and more important. People are taking their lead from what's going on here in the United Kingdom.
5 years ago, I don't think people were aware, consumers were not aware of the issue of climate change. Businesses were, but not very heavily. About 2.5 years ago, it went onto the agenda of most of the FTSE 100 companies. It's now in the consumer domain, if you like. You can't switch a television on these days or read a newspaper without seeing some comment about the impact of climate change, whether it's melting glaciers or melting icebergs or polar bears standing on an ice pack and looking sort of concerned as the ice melts. People are aware of the issue. That's the first thing. The second thing is government are advertising, and advertising heavily and asking people to make a change. And if you look at the existing campaign, which is Act on CO2, this is going to be the focus of government advertising, if you like, to get people to change the way in which they do things. The third thing is consumers themselves are very responsible. They want to buy products from responsible companies, and the labelling process that the Carbon Trust has introduced is a first step to getting people to understand that some companies are looking at the carbon that is emitted in the products they sell, and because I understand how much carbon is emitted in there, I'm demonstrating to customers that I'm counting it and therefore I'm doing something about it. And that is key. The fourth thing is that the younger generation, based upon our research, are very concerned about this issue because they're the ones, they and their children, the ones that are going to have to live with the results. So they are demanding that their parents take action and we switch something off now. And finally, I think, as we move towards oil at £200 a barrel, gas prices at the highest level they've ever been, petrol prices at an eye-watering level, that in turn is going to drive consumer behaviour. It may not cause me to sell my car, but it may cause me to use it perhaps less intensively than I did before. It may cause me to get on a bicycle and cycle to the shops instead of going in a car because it costs so much more. And of course, with improving public transport, and I think of the United Kingdom and the railways, which are running at record levels of passenger numbers, partially because of jet congestion, partially because of cost, then with more alternatives available, consumers themselves will make the switch.
Spirax Sarco is a global leader in modern steam systems. We are known for our quality products and outstanding expertise that we supply to our customers both here in the UK as well as around the world. We have a long track record of working with the NHS, probably over 60 years now, and during that period of time we've worked with nearly every organization within the Trust. We think we understand the pressures faced by hospitals today in terms of reducing their energy costs and becoming even more environmentally friendly. We have a proven track record as a quality supplier to the NHS. We're delighted to continue to work with them and feel like we have the kinds of solutions that they're looking for in terms of saving energy and becoming more environmentally friendly.
Spirax Sarco steam systems keeps patients clean, warm and comfortable. They deliver hot water for bathing and hand washing, steam for heating, humidification and sterilisation. On the equipment side, we're able to offer complete boiler house systems through to individual valves and steam traps. With over 200 staff in the UK alone, we are confident that we can actually meet your needs. Hospital managers know that they need to cut energy consumption and save money to meet the environmental targets. We can assist them to do this. To improve efficiency, we're also able to reduce maintenance and minimise downtime.
The NHS is responsible for about 3% of the carbon emissions for the UK. This makes it the largest public sector contributor to emissions. The carbon strategy set out by the NHS commits it to meeting the UK Climate Change Act's requirements. It's going to be really tough. NHS emissions have grown by 40% since 1990, despite good efficiency improvements. In the medium term, the NHS has to meet the target of reducing emissions by 10% by 2015. The trick is for it to meet these reductions while meeting the requirements of its health, safety and comfort of its patients and staff. Spirax Sarco understands the pressure the NHS is under. Looking at it positively, if we take some of the best practice already developed by some of the NHS trusts, we firmly believe this could set a benchmark and show others how it's done.
Our product range covers the entire steam and condensate system, which incorporates boiler house and energy recovery plant. But what makes Spirax Sarco important to the customer is that we're able to deliver on-site support for that customer, and more importantly, we're able then to comply with legislation and technical memorandums associated with hospital plant rooms. One of the requirements in modern day healthcare is 24-hour priority response. Spirax Sarco are able to deliver this through our own engineers visiting the hospitals as and when required. Part of the ongoing support that we offer is our training packages, and the training packages both on-site, off-site, and at our purpose-built training centre here in Cheltenham. With over 75 courses being scheduled for 2010, we anticipate 700 delegates to attend these courses. One of the most popular solutions for the NHS is the Easy Heat system. Using plant steam, it produces hot water and heating on demand. It ticks all the boxes for the hospital manager in the sense that it actually reduces downtime, maintenance, and improves health and safety, but at the same time reducing the energy consumption of the plant.
I've been working with Spirax now for approximately 10 years. In my opinion, they're world leaders in the manufacture of steam products. I've specified the Easy Heat for approximately 5 years now. The benefits that it gives me is less water storage, reduces the risk of Legionella. It gives me steady state temperature control. It's low maintenance. It's quick and easy to install. It frees up space in my plant rooms. It reduces my carbon footprint. My typical payback is between 3 and 5 years. Above all, it gives me peace of mind. I know that my patients are safe from using hot water, and it keeps them warm in the winter months.
Another area of interest for NHS customers is a closed-loop energy recovery system called the FREMI. The FREMI system is a pre-commissioned unit which is delivered on-site as a total package. Leighton Hospital, for example, installed a FREMI system which resulted in them saving 95 tonnes of carbon emissions and reducing their annual fuel bill by £10,000. The FREMI and the Easy Heat systems are pre-commissioned, pre-assembled units which in actual fact have a faster installation time, reduce maintenance and, more importantly, cut out a lot of the hassles associated with a project.
Our customers around the world are under increasing pressure to improve their operations, to save energy costs, to become more environmentally friendly. And certainly the NHS within the UK health sector are under many of the same pressures. They have set ambitious targets. We are proud of our people and our long relationship as a supplier to the NHS. We're in a terrific position because of our expertise in steam systems to help them achieve their targets for energy savings as well as increased environmental friendliness.
We hope this programme has been a valuable resource for NHS trusts in their mission to reduce energy costs and carbon emissions. I'm Georgina Burnett, and you've been watching Solutions for a Sustainable Health Environment.